Dr. Sear, welcome to Podcastina.
Thank you very much.
So, can we start with just a little bit on your background?
Sure, I am a board certified spine and cosmetic surgeon, the first in America to be board certified in both. I have about 22 years under my belt of spine surgery. I trained at the Mayo Clinic for spine surgery in a combined neurosurgery program and orthopedic surgery of the spine program, which is pretty unique. And after that, I then was in the military where I was the chief of spine surgery and the consultant to the Surgeon General and Pentagon for about 6 years. I was active duty for a total of 14 years. So prior to my fellowship, I was an orthopedic resident in the military and the Air Force. And I did a 2 years stint as a flight surgeon in the Air Force prior to that, and attended medical school. I'm going kind of backwards on my timeline, but I attended medical school at the University of Texas in San Antonio, and I played football in college at Texas State, which is what it's called now. Back then it was called Southwest Texas State University.
That's so unique. What is it that made you choose both of those?
Well, I think for me, spine surgery was my initial passion, and that came about as an initial passion out of orthopedic surgery, because I was an orthopedic surgery resident, and in that residency, like most residencies, we do rotations on all the different specialties, and I found spine surgery to be the most captivating. I felt like it was the most complex, it was the most poorly understood, and so that's what drew me to it initially. And it was the kind of surgery that required a certain specific meticulousness and attention to detail that a lot of other fields don't require, and it just fit my personality really well. So that was what I did for a long time. And in the process of doing my spine surgeries, a lot of my approaches to the spine and the lumbar spine and the lower back removes the disc from the front of the spine. So a lot of people don't realize the best way to remove the disc in the lower back is to go through the front. So we have to go around the abdominal sac and then get to the disc, move the big vessels from the heart to the legs. And in the process of doing those anterior approaches on the spine, I had multiple patients, both men and women, joke, halfway joking, about doing a little work on their stomach while I was there. And it just started to make me interested. There was a time in my residency where I considered plastic surgery as a field. And then I thought, no, I'm going to stick with spine. I like spine. And so I stuck with spine. And when people continue to ask me that, I was always very aesthetically focused on my surgeries as a spine surgeon. The the angle of my screw insertions, how I closed the wounds. I did a lot of orthopedic trauma because I was in the military. And so I was always focused on the cosmetic result of the closure of wounds. And when they started asking me about doing work on their stomach, and it just really started making me think, should I actually learn to do this? Because a lot of patients that had additional abdominal skin and tissue would hang over their stomach, and it would be really hard to brace them after surgery. And so I thought, I should learn how to do this because I think there's a functional benefit to it. And then, of course, in order to do it properly, you have to do a true fellowship, in my opinion. So I did a fellowship with the American Board of Cosmetic Surgery president at the time. I did 2 years. I had to take a 2 year hiatus to focus on cosmetic surgery training. And after years of being a spine surgeon and being at kind of the top of that field, I had to kind of relegate myself to a position of a student again, which is pretty easy because I'm pretty humble about it all. And so I knew that I had a lot to learn. And so I did a fellowship with him and learned for 2 years about cosmetic surgery procedures and learned the whole gamut from, face to body. And as an orthopedic surgeon and as a spine surgeon, the musculoskeletal appearance was also something that I was really kind of keen on. And I had been an athlete, so making people look fit and making sure that their body matched, as they age, their body matched their mentality, I thought was a really nice thing that we could add to people on the medical side of things.
That is really cool. And on the surface, it doesn't instinctively feel like those two things would have anything in common, but I'd love to hear from you. Did you find any sort of overlap in those two?
Well, amazingly, there's a lot of overlap, and primarily when it comes to things like preserving soft tissue, protecting soft tissue, knowing where vital structures are. In order to do surgery on the bone, whether it's the arms, the legs, or the spine, you have to know all the superficial anatomy to get there, right? We can't just cut through things without knowing the anatomy. So if I do an anterior approach to the spine or the neck or the back, when I'm going to the back of the spine, or if I'm doing something on the legs or arms, I have to know all of that anatomy, right? Where the nerves are, what the soft tissue plane looks like above it, how to get in between the nerves, how to avoid damaging the blood vessels. So all of that knowledge that I had as an orthopedic surgeon and then subsequently as a spine surgeon, it helped me a lot. If I was someone who learned from day one as a plastic surgery resident or as somebody who had been a general surgeon who didn't understand the anatomy of the arms, the legs, the spine, the belly, the back, the neck, all of those different areas of the body, if I didn't understand that anatomy like I did, then the learning would have had a much higher learning curve. And I didn't have that steep of a learning curve because I already knew the anatomy and already understood complex tissue treatments. I understood how to take care of wounds that were open, that were gaping open, that were under tension, infections. I understood all of that from my time in the military. So that made a huge difference in my ability to learn these procedures quickly and then adapt more technique than I think a lot of people understand about when we're sculpting the body, for example, doing a liposuction. If you don't understand what the muscles of the body look like or how the body's musculature should be shaped, you could sculpt the body improperly. And there are people out there that have sculpting of their body, high definition sculpting of the arms and the legs and the stomach, especially the stomach, that look anatomically abnormal. They look weird because they don't understand what the muscles look like, where they begin on the bone, where they insert on the bone. And all of those things are learned in depth by orthopedic surgery training. So I kind of crafted new techniques that I think really help make the aesthetics of the liposuction look a lot better because of that understanding. And then, of course, always focusing on safety. If you don't know where the nerves are, where the blood vessels are, you can get into big trouble. And so that all of that stuff I understood very well. And so it actually lended itself very well to learning cosmetic surgery techniques. And I think actually maybe enhancing those techniques as well.
That's really remarkable. I have to ask, when you see people like out at the gym knowing what you know, do you worry about their backs? Do you kind of look at everything through the lens of, oh, don't do that, you're going to hurt your spine?
Oh, all the time. I've lifted weights my whole life, and I read every muscle magazine you could imagine from the time I was like 14 until I was playing football in college and through college. So I've always been really, really keen on bodybuilding and sculpting the body and lifting weights. And so that's a huge part of my life still today at 55. But, I know there are exercises now as a spine surgeon that are not necessarily ideal for your back. And there are a lot of them that are very popular. People still do heavy deadlifts and power cleans and some of the CrossFit moves without good control, just cheat sets and throwing weights up and down and things like that that tear the rotator cuff, that cause disc herniations, that cause trauma to the body. Your body looks good, but your discs and your soft tissue, your connective tissue, is bearing the force and the brunt of that stress, and we're seeing a lot of injuries because of poor technique, and also just the position of our body. Like when we're doing a deadlift or if we're doing a heavy leg press, your body is in a forward position, and all of that weight is putting pressure on your spine, and so that makes the disc more likely to collapse or herniate or even internally tear, which leads to degeneration of the disc, and degeneration of the disc is basically arthritis. So if that happens, then you're kind of setting yourself up for future problems and maybe even future surgery, which of course everybody wants to avoid.
It's interesting because on the one side of it, like cosmetic surgery is such an elective thing, and then spine surgery, while I'm sure there's an elective element to it, most of the time people are going in because they have to, because their back is hurting, they can't stand up straight, or like, God forbid, it's some kind of injury.
Yeah, there's almost nothing more elective in medicine than cosmetic surgery. It's as elective as it gets. So everybody I treat looks fine the way they are. Could they be better? Yeah. It's one of those fields where the patients are very different. They come with different expectations and they come with different needs. And cosmetic surgery patients sometimes are hard to please, and spine patients couldn't be any worse, or else we wouldn't be doing surgery. So they typically are very happy. And whereas cosmetic surgery patients can have an amazing result and still feel like they still don't look like him or Kylie, and they're not happy because of it. So you have to be prepared for those types of patients when you're doing any specialty, and you have to, if you're getting into it, you have to be aware of what you're getting into. And I spend a lot of time talking to patients, whether they're spine or cosmetic, about expectations, because I think it's important to have realistic expectations. Obviously your hopes should be high, but your expectations should be reasonable.
Of course, and knowing what you know about just the surgical process, is there something you know about surgery that you wish you could instill in all your patients?
Yeah, that it's a process, that nothing heals immediately. Surgery takes time. Even the best surgeon and the most compliant patient needs time to recover from surgery. Spine surgeries take 6 to 12 months to heal, and honestly, so does the body. people don't realize that the cosmetic surgeries, there may be an immediate improvement in your result, but that continues to slowly remodel, and tissue continues to heal and mature. Scar tissue forms and then softens, and then it gets better. So there's a time in that healing process where I think spine patients tend to be a little more patient with it, and cosmetic surgery patients aren't. And I think that if you're not willing to have the potential of a complication, you shouldn't have surgery. That's something that I think all people should be aware of. Everybody thinks, oh yeah, no problem. I'm just going to walk in, no big deal. But they're not ready for the process of healing. They expect immediate results. And I think if you go in with that expectation, you're going to be unhappy with the outcome, regardless of if it's going to be amazing or not in a year, because a year is a long way from the date of surgery. So you have to be ready. You have to be patient. That's why patients are called patient. You really have to be patient.
I'm sure you've probably seen the recent headlines that Kris Jenner has come out and said she's now not happy with her facelift because some time has gone by and it looks different. Is that pretty typical with that type of procedure, that it like looks good in the initial months and then starts to slack a bit?
Well, there's no facelift that doesn't relax. All facelifts relax, and there are some surgeries where you see, especially in Asia, where they're doing extreme tightening of the tissue. In America, we don't really go that far. We don't trust the soft tissue that well. When we're doing our surgeries here, we try to make it look more natural. There's a big push right now for deep plane facelifts. Everybody talks about deep plane facelifts versus what she had, which is we call it a smastectomy. A smastectomy is basically where you do a smaller approach. You don't take as much tissue away. You make a smaller incision. You do have to take the muscle and overlap the muscle, but mostly you're concentrating that to this part of the face. Whereas with the deep plane facelift, it can come all the way down, and some approaches even come down into the neck, and they tighten the muscle here, they tighten the muscle here, all the way back. And so the results tend to be better, but there is a higher risk to those more complex surgeries, a higher risk to the nerves. Nerves can get stretched, nerves can get damaged, even with a really talented surgeon. So, every surgery has its pluses and minuses. And I think the deep plane facelift has less chance of sagging in time, but even that doesn't last forever. Even a deep plane facelift that looks amazing probably lasts between 5 and 10 years. 10 years is what we hope and expect, but at 10 years, it's going to sag. The faces like hers that have had a smastectomy, which is what everybody's saying she had, I don't know for sure. I think her surgeon did an amazing job. I don't think anybody could objectively look at her and say she's not happy, but that's a great example of someone who looks remarkably better than they started, and they're still not happy. That's one of the problems with that surgery population, is that people tend to have expectations that things are going to be perfect and they're going to look amazing forever. And even the best surgeons there's going to be some relaxation of the tissue. So I think he did an amazing job. I think she looks great, but there is going to be a little bit of relaxation of the tissue with time.
With procedures like that, how much do you think like social media's impact is having on the way people think their bodies should look?
Well, I think social media is that's what makes social media tough or terrible, I guess you could say. Social media is great for so many things, communicating, marketing, all of those things are amazing. But you never know nowadays what's real and what's not. People are looking at social media, women and men on social media who look amazing, and they may not even look that good. You may not know what it is. It may be lighting, it may be apps. You don't know what they're doing to look like that. And so it makes it hard, I think, for people today when they're looking at other people on social media that they aspire to look like. Those people may not even look like that themselves. So I think there's a problem with that, and looking at things that may be unrealistic to attain or achieve, and whether that's even realistic or real is the question. You don't know. I think that's the problem with social media. I think social media is good because the news gets out quickly, but there's a lot of bad information. There's a lot of people out there there's a lot of people out there who just want to spread negativity, and there's a lot of people out there that are trying to do positive things. So it's like everything else. There's plus and minus to it. I think there's a lot of good. For me, social media has been really remarkable because it's drawn a lot of patient attention to me and what makes me different as a surgeon, and hopefully my compassion and heart for taking good care of patients and having good results. That's something that you can promote and show to a bigger global audience when you have social media. But there's definitely some negatives, and you have to remember that when you're looking at results, whether it's on social media or on a website, doctors always show their best results, period.
Right.
They're showing their 20-year-old patients who had like an immediate recovery of their skin, no bruising, no scarring. They're not showing you the healing process. And some people do, but it's not an attractive thing to show. The healing process is pretty scary. There's bruising, there's swelling, the tissue's draining. If you have liposuction, your face looks terrible after a facelift. People get actually depressed clinically around 3 to 4 weeks when they think they're never going to look normal again. And then that stuff, it slowly improves and slowly they recover. Even nerve injuries typically heal. Sometimes it takes a year, year and a half if you have a nerve injury. But people want immediate satisfaction. And you just have to, I think the most important thing to take away from social media is, number one, be happy in your own skin. Try to optimize how you look and your health most importantly. But if you're going to do surgery, come into it with full realization that there can be complications. Make sure you do your research. Make sure you're compliant. That's another thing people don't think about is, they have operations, but they're not following the rules. They're not following the restrictions. They're not eating correctly. They're not wearing their garments. They're doing too much, or they're putting themselves at risk, or if they smoke, they're smoking. If they're not careful with their wound care. There's so many things that can go wrong, even when the surgery was performed very carefully and very well. So you have to be a compliant patient, number one, and you have to be realistic with your expectations, and you have to be informed. There's no reason today not to be informed about what you're getting into. And then you need a doctor who's willing to take the time to explain things to you in a very clear manner so that you know what you're getting into. Tell me the timeline. What can I expect? What are my risks? And then come into it with full knowledge and the realization of what can happen. And again, I can't overemphasize realistic expectations for surgery.
To piggyback on that, I'm curious, how much of this is psychological for people, and if you've ever had a case where you've had to turn someone down, like let's say, we've all kind of seen. Last week I was walking by a woman that just had like comically large like fake breasts. And I can't help but to look at someone like that and go, is that irresponsible of the doctor to even green like that? Have you had someone come in with like objectively fine body parts and had to say no to whatever it is they want?
Oh, all the time. I'm pretty conservative I'm a very conservative surgeon. I train with a very conservative cosmetic surgery professor, and I also trained at a very conservative spine program. And so when I do surgery, I do big surgery, I do complex surgeries, but I'm also very careful about who I select. I think patient selection is a huge part of having good results, because especially when it comes to what your example of a cosmetic surgery patient who looks comical, that's something that there's a mental side to cosmetic surgery. There's body dysmorphia that is very common for cosmetic surgery patients. It's the patient population who has the highest body dysmorphia percentages, the higher mental issues like depression. And so surgeons, they're putting themselves at risk when they give in to the whims of every desire. And I think it is a surgeon's responsibility to say, I don't feel comfortable doing that. But there's always going to be surgeons out there that feel like they need to give the patient what they're asking for. I've had spine surgeons say, somebody comes in, they're not really a surgical candidate, but I'm going to give them what they asked for. They came to see a surgeon, I'm going to do surgery on them. I've heard that before. Not where I trained, but I've known people in the civilian world that have said that. And I know that there are cosmetic surgeons out there that will basically do whatever you want. You want to craft your own body parts, in a lab and bring them in, and I'm going to create this new body for you out of silicone. They do it. There have been shows that have shown it. And I think there are always going to be doctors out there that are willing to do whatever the patient asks for. I don't think that I would ever. Obviously, I would never do that, and I don't recommend that. But I think that there is an issue with body dysmorphia in cosmetic surgery. So you're going to see that, and people sometimes are in it for the wrong reasons. Surgeons are in it for the wrong reasons. Providers, it's not just surgeons anymore. You can make somebody look abnormal with filler, and there's so many
Mm-hmm.
people that are non-physicians that are doing filler and other non-surgical procedures that also have bad results that look cosmetically very strange. And so there's this huge trend towards overdoing things. And for me, my focus is always natural, natural, natural. I want to enhance, but I want you to look like yourself. I think you should look like yourself and enhanced. And my focus on most patients is to turn the clock back, not to change who you are. So that's my focus. And if someone wants to be a totally different person, they probably wouldn't want to come to me, because I just want them to look like themselves, just enhanced and rested. So yeah, you have to be careful where you go. But some people want that, and you're going to always find doctors that are willing to give them what they ask for.
It's a little unnerving that there's not some kind of like ethics oversight for everybody. I mean, I know they can like leave the country and do whatever, but that there's kind of no system to be like, hey, that's enough, knock it off.
Yeah, I think because it's so subjective, am I beautiful or not? Well, if your cheeks are out to here, the average person would say no, but some people like it. I don't know. I don't know that it's an unethical thing as long as there's not a complication. And that's what the patient wants. I think there are doctors out there that are more conservative and doctors out there that are literally on the envelope, on the edge of the envelope, doing whatever.
Do you have a procedure that's your favorite to do?
I think breast augmentation is my favorite. It's the easiest. It has the quickest turnaround. The results are there's minimal healing process. I mean, the healing still takes 6 to 12 months, but it looks good right away. Patients are usually happy right away. Other surgeries where you have to remove tissue, you have to suction tissue, you have to tighten tissue. All of those things are a much, much slower process, but the recovery and the turnaround on a breast augmentation is pretty fast. So you get immediate gratification as a surgeon and as a patient. So those are, I think, the most straightforward, easiest, and most happy patients. All the others, take a lot more work and time and effort. And when you're doing stuff like me, I do a high definition liposuction. So it's a very physical and manually demanding surgery because it takes like 5 steps instead of, we're not just suctioning the fat, we're putting in infiltration of fluid to let it sit for 20 minutes to decrease bleeding and pain. And then we're ultrasounding to liquefy the fat. And then we're sculpting. So it's a lot higher level of it's a process driven procedure that takes so much time just because of the steps. And then you're tightening the skin with radio frequency, and then you're suctioning, the smoke from that procedure. So those surgeries, I think, even though the results are really good, they take a lot of time. They're very intense manually. So that one's not quite as immediate gratification as a breast augmentation. So I think I would say breast augmentation. And then of course the non-surgical stuff like fillers and injectables, those are all pretty quick turnaround too. Most people look pretty good, pretty fast.
Do you have a least favorite to do?
My least favorite, probably a facelift. Yeah.
Why?
Just because the risk, if the face is one of those things where people are unhappy for a while because they look really strange for a while. A lot of times, if you're doing a deep plane facelift, the nerve risk is high, even if you're careful. Not high, the nerve risk is low, but it's higher than other surgeries. It's one of those things where if your facial nerve is stretched or damaged and it's visible, it's your face. If your
Mm-hmm.
body is healing, you can cover it and let it heal, and you have clothes on. But your face, that it's in your face, right? So every day patients are looking at their face and like, oh my gosh, when is this going to become normal? And so I think that one is probably my least favorite. But it is also one where the results can be dramatic and amazing. You can really make somebody look better, much younger, by doing a facelift versus trying to overfill. I think there's the reason people are pushing deep plane facelifts right now is because the results when they go well are amazing. They really are amazing. People look so good, but it's a slow process. Whereas with fillers, you can only go so far, but it's it's fast, and the downtime and the downside is minimal. So I think there's a lot of people out there though that are trying to use fillers to do what a facelift should be doing, and you can't really do that. That's why you're seeing overfilled faces.
Speaking of filler, I've heard this, maybe you can myth bust it for me. If you want to get a facelift later down the line, are you supposed to avoid filler?
It makes it harder. I mean, anything you do to the face, whether it's fillers or threads or radio frequency, microneedling, anything you do to the tissue under the skin, it becomes more difficult to do a facelift. Not impossible, but it becomes more challenging for the surgeon. The tissue sticks together, scar forms. So now you have to dissect scar away from the normal tissue to mobilize and to tighten. So it definitely makes the surgery much harder for the surgeon who's doing the facelift. But it's not contraindicated. It's a more challenging experience for the surgeon. And you have to know that if you're going to do it and you have a facelift, the risk of you not having the perfect results is a little bit higher.
Mm. Yeah, I think people should know that in advance if it's something they're planning for, because just creating that many more barriers to getting the result you want is going to impact you down the road.
Well, I think most patients are expecting to never have a facelift, right? They're hoping
Yeah.
never have a facelift, and I'm just going to do filler instead, and Botox, and all these other non-surgical tightenings, laser, radio frequency, microneedling. Same thing with a tummy tuck. Everybody's like, I'm never going to need a tummy tuck because nobody wants those big scars, or a brachioplasty where you make a big incision on the arm, or a thigh plasty. Nobody ever expects they're going to get to a point where they need that stuff when they're younger. And so they're doing everything else short of that. So, it's hard to say that in the future I might want a facelift when your face doesn't look like you need a facelift. So it's a rational, I guess, progression to start with the small stuff. And then when you get to the point where you're now 40 or 50 and you've been doing stuff on your face for 30 years, that's a lot. It's a lot of scar tissue for the surgeon to work around. So it does make it harder. But you hope that you never get to that point. It's just that some people do.
Why is it that I hear that BBL is the most dangerous surgery?
I think BBL is the most dangerous. Yeah, it is. And the reason it's most dangerous is because the risk of injecting fat into a blood vessel, which can kill you, cause a fatty embolus, is higher than the risk for the other surgeries we talked about. The facelift risk, the nerve damage I'm talking about, the reason I like it less is because it's in your face, right? But the nerve risk is like 1%. It's super low, like less than 1%. It just takes a long time for it to recover if it happens. For the BBLs, the risk is you might not make it off the table if you're young and healthy. And that has changed the way a lot of surgeons do surgery. The cosmetic surgery world has always, at least my academy, has always done the fat injections above the muscle. We've always done that. It's always been the recommendation. And there were some plastic surgery experiences where they were doing injections into the butt muscle. So if you inject into the muscle, that's where the blood vessels are. And if you do that, then you hit a blood vessel, then that's when you could potentially die. So the entire world of cosmetic and plastic surgery has now kind of backed off and injecting into the muscle. Now there are criteria that it's all subcutaneous, which means above the muscle, and you do it with an ultrasound. Most people follow that criteria because if you look at where you're injecting it with an ultrasound, then you have very little chance of injecting into the muscle. So that's what most of us are doing now. So the chances now of that happening are very small. They're much lower than they were before.
I'm curious what, if you've seen it yet or if it's too new, but what the impact of people being on GLP-1s is doing to either previous surgeries or future surgeries.
Oh, I think there's a massive impact. I think cosmetic surgery has dropped dramatically for specific procedures like liposuction. People are on GLP-1, so liposuction has dropped dramatically. All the people I know doing cosmetic surgery, I think in general, the volume of cosmetic surgery has dropped since COVID. During COVID, people were going crazy for cosmetic surgery, and now it's really slow compared to then. And I think that's because people had a lot of free time on their hands back then. Nobody was really working in the office. But now with the GLP-1s, I think GLP-1s really have a place in a lot of people's medical regimen for certain things, like even PCOS, which is now called PMOS, but because it's more of a metabolic or an endocrine disorder, and people that are diabetic and people that just can't lose weight no matter what they do, to protect their heart and the rest of their body. I think GLP-1s have a real place in medicine. And because of it, people are losing weight and not needing liposuction anymore because they're eating less. So I think that's a positive trend. For me, anything that will get you away from a surgeon, even though I'm a surgeon, I'm in favor of it as long as there's not some kind of detrimental side effect to it. So, but I do think that because people are getting the Ozempic face that everybody talks about, where you get this dramatic wasting of the face, you lose the fat in the face superficially and deep, you're seeing more people need fillers. So their body looks good, but their face looks gaunt. That's something that bodybuilders have always battled. When they get really lean for competition, their body looks amazing, their face looks terrible, right? They look old.
Mm-hmm.
So they're getting more fillers. So I think fillers are probably on the uptick and liposuction is down because of the GLP-1s.
If you got a BBL and then you get on a GLP-1, is it going to undo it?
Yeah. If you lose weight in any way, whether it's weight loss naturally or with a GLP-1 that helps speed that up, the fat you lose, of course, you lose fat everywhere. You have fat, whether it's in your face or your butt. So the same thing with your breast. If you lose a lot of weight, you lose your breast tissue too. Anything that's fatty tissue, you lose. So people losing weight are going to lose it everywhere. But when you lose it, if you have more fat than you did before, you'll retain more fat than you would have prior. Otherwise, you'll still have more fatty tissue than you would have had. So it won't be quite as flat as if you never did it. So maybe there's still a benefit to it.
What do you do when a patient comes to you and they say the buzz phrase of the day, which is, I've done my own research?
Yeah, it depends on what they're talking about. What kind of research are they referring to? If they say they've done the research and they're the experts now, then of course, I just tell them my perspective and my opinion on things and my experience. And if they're saying they did the research and that's how they found me, that's a good thing. So it depends on what they're talking about. as
Mhm.
patients now, there's no reason not to at least be informed, but there is a lot of information out there that's misinformation. So when you come, what you think is informed by the internet or however you're getting your information, which is usually the internet or other patients, you just have to know that you may not have good information, that it could be faulty information. And when you talk to a surgeon, there's a real expert you're talking to. And also there's a different level of knowledge from surgeon to surgeons too. So, you have to do your research to figure out who you're going to and what their approach to surgery is and what their approach to patient care is, what their training and background is. But you have to also realize that if you're reading about certain procedures and what's cutting edge and what's the best, a lot of times you're reading biased marketing. And that could be biased marketing from the company who made it or from the surgeon who's doing it. So you have to be really prepared to get the surgeon's perspective on that when you go see somebody.
Has there been a patient that's come in with like a particularly egregious piece of misinformation that they've come to you with and you've had to be like, "Oh no."
Well, I mean, I don't know if it's egregious, but there's stuff that I disagree with all the time. As a spine surgeon, being trained at Mayo, the Mayo Clinic, in my opinion, obviously I'm biased, but it's the number one program in the world for spine surgery. And so my experience at the Mayo Clinic and then my experience as the chief of spine surgery in the Air Force is very unique. I've done a lot of complex surgery in my 22 years because of that. And so I have a different perspective than a lot of surgeons on spine surgery. And so people will come to me and, they've heard all the horror stories. I think for me, there's not necessarily a procedure, but a lot of it is just the fear of surgery. Like I'm going to have an operation and I'm going to have multiple operations as a result of this one operation. That's a very common thing in the spine community, right? You have one surgery, that means you're going to have 5, 10, 15 surgeries in the future. And it's actually not true when your surgeon does the workup properly and the surgery properly and you follow the instructions properly, right? So it takes a team of people doing things correctly. There are procedures that people bring to me like, oh, I read about this procedure, this nucleus replacement, which is a disc replacement technique, or fusing only the facet, or putting a spacer between the bones in the back of the spine. There's things that I don't do, that I don't agree with, and I'll explain to them my take on it and why I don't prefer it. There's different processes that I do, and I tend to do surgery with a bigger workup. I order more tests than a lot of people because I'm looking at specific things from each test. So every surgeon has their preferences, and a lot of it has to do with where they trained and then, of course, their personal experience. So that's why it's so important that when you go to somebody, you've read a lot about them. Read their testimonials, read what patients say, not just what their staff says about them or what they say about themselves, what people say, and how long those testimonials are and how heartfelt they are is very important. You have to look to see, does this person really spend time with patients? Are the outcomes really good? There's not a surgeon out there that doesn't have some unhappy patient who is probably, sometimes there's a justifiable reason the patient's unhappy. A lot of times it's just an unhappy person who will never be happy. And then sometimes they're fake reviews by competition. It's crazy the
Mm.
stuff that people will do to each other in the world of business, and that includes medicine. So when you look at reviews, there's going to be some negative reviews for everybody, but look at the grand scheme of the reviews. What do they say? How long are they? How heartfelt? How much do they praise their outcome and the result of their surgery? That really matters. And so I tell everybody, inform yourself with that kind of knowledge, because when you go to somebody, you're going to get personal preferences of that surgeon. And in spine surgery, we always joke about, if you see 5 surgeons, you're going to get 6 opinions, right? So you have to be careful about who you're talking to because they're always talking from their own perspective.
Has there been any kind of recent breakthrough with spine surgery that you're like, "Oh, thank God this is going on right now. It's
Well, for
revolutionary."
like 20 years, we've been talking about stem cells, stem cells. We're going to germ cells, stem cells. We're going to inject into the disc. We're going to stop the process of arthritic wear and tear. And I think we're getting closer to that. There's hyaluronic acid processes that are being tested right now. Injection of hyaluronic acid into the discs, and there's people testing stem cells into the disc, and those things I think have promise. If you get to the disc before it's unstable and before it's collapsed and shifting all over the place, I think if we can get to the early stages of the process of arthritic wear, which is what we call degenerative disc disease in the spine, I think those things are very promising. There's a lot of stuff out there that I'm not jumping on the boat about, like, um, I guess robotic assisted surgeries and 3D
Mm.
surgeries and stuff like that I still don't believe they've proven themselves. And so far, the tried and true that I continue to do the more standard approaches I think have the best outcomes. And minimally invasive, there's a big push for minimally invasive, but the problem with minimally invasive surgery and spine surgery is if you're trying to fuse someone's spine and you think that making a smaller incision makes it more successful, then you're mistaken. Because in order to get the spine to fuse, you have to put enough bone along the spine in order for the bone to fuse. The screws are not the way that our spine fuses together. The screws are just a splint. And there's this big marketing push, and there has been for a while, to do everything minimally invasively because we have to protect the muscle. And the muscle only matters when the spine is stable. If the spine is unstable, you can be the most muscular person on the planet. Your muscles can't overcompensate for the instability in your spine. So the number one thing that we have to accomplish in a fusion is the fusion. And that's a process where it requires exposure of the bone to lay enough bone down to ensure the bone heals. So minimally invasive surgery, in my opinion, compromises that. So that's something that I still am not completely on board with. Now, when it comes to freeing the nerves of pressure, I do those procedures minimally invasively because I can make a small incision without compromising the outcome. So minimally invasive, in my opinion, is only good when the outcome is equal to the open approach. If you're compromising the outcome just to make a smaller scar, I think you've lost the important focus of that procedure.
Yeah, I didn't know about I always thought it was just cosmetic only. I didn't realize that cutting deeper into the muscle, does the muscle not recover from that? Is that the argument?
Well, so we have to elevate the muscle. We don't cut the muscle, we just elevate it from the bone. So we have to move the muscle away from the bone in order to put enough bone in along the spine. You can do it with small poke holes, but all you're doing when you do that is you're making small incisions to put the screw into the bone, and the little joint in the back of the spine, you're putting bone in the joint, but you're not putting bone along the side of the spine. And so for me, I think that's a compromise on the success rate. And also, people are doing one incision, they're doing everything from the back because it's only a single incision, versus a lot of times I'll do surgery in the front first. And that's what we talked about earlier, because the disc is in the front and you can take the disc out more thoroughly and you can put a bigger cage in there to support the spine with more bone, because bone, again, is what makes the spine fuse. If the bone never fuses, the screws will break or loosen or back out, right? So that's something that's very important for patients to realize, is that minimally invasive may not be the best answer for you, and you have to make sure that you're looking at all the information. But for me, that's one of the things I think cutting edge, you have to be really careful about all these cutting edge ideas because a lot of them haven't been proven, and some of them are just marketing gimmicks without better outcomes.
With the rise of what they're calling tech neck, people being in this position all the time, is that going to have, or maybe it already has, you tell me, what are like the consequences for people's spines being looking down at our phones all day long?
Oh, we're definitely seeing a problem with people that are on their computer and especially on their phone all day long with that flexed position of your neck. Every inch forward adds multiple pounds, 10 to 40 pounds of stress to the disc. So what you don't want to do is have your head in this position when you're at work or when you're on your phone. You have to make sure everything's up, because what it does over time is that excessive pressure on the front of the disc, we already have 80% of our weight is carried in the front of our spine. So the further forward we go, the more weight we add on this and the stress we add onto the disc, the more that's going to do. One thing is going to be, it's going to tighten the muscles in the front and loosen the muscles in the back. So you'll have this abnormal position because of the muscular imbalance. But then on top of that, with time, it'll start to add more strain to the disc. So the disc starts to wear out faster, which you don't want, because once that happens, and now you have arthritis, that arthritis progresses the more you're forward. And that's why you see, unfortunately, people like me, spine surgeons and dentists, and people that are like this all day long, they tend to have more problems with their neck. They have disc herniations and arthritic changes in their neck more than the average person, because their job is like this all day long. And now the average person is spinning all day long like this. So they're going to see the same number of problems with their neck that we're seeing in the community of people that work with their head down all day long. And you don't want to be one of those people. You don't want to end up having neck surgery. So, we don't have a choice, but you do. So use good ergonomics. Keep your phone at eye level. Keep your computer at eye level, and that's, I think, a way to try to protect you. And then, of course, everybody should be in the gym. Everybody should be working out. They should be lifting weights. I think weights are one of the keys to staying young and functional. Lifting weights with careful and good form is important. Being flexible, stretching your muscles so that they're not just muscular, but they're also flexible. That balance is very important. So I think that that's something that people need to be doing all the time. And that'll help counteract some of that head down process. I think for me, I actually had a disc herniation early in my career in my neck. and I didn't have to have surgery. It resorbed. Luckily, I was one of the lucky few, but it was a function of being head down all the time. And so, in time, my neck got stronger and I was able to tolerate it more. And I think that's something that you can do to yourself by lifting weights and building your body. So I recommend everybody lifts weights and stretches on a daily basis if possible.
What do you think of those kind of medieval looking machines where people like hang upside down and they have their head in the thing?
Are you,
Is that effective at all?
are you talking about which one are you talking about? The inversion table or something like more new, like there's all kinds of stuff where people are doing the neck strengthening. It looks
Yeah, I guess any and all of it. Does any of it work, or is it all kind of just gimmicks?
well. I think traction is good. Traction is actually something I always recommend. I think hanging from a bar or doing an inversion table where you're hanging. I think to some degree taking the tension off your back will help unload it a little bit. Of course, you still have to have the muscular support around your spine because the bony architecture of our spine is held together by soft tissue. It's held together by joint capsules and disc material and ligaments and then the muscle attachments to the spine. That's what provides support to our spine and stability and alignment. And if your muscles are out of whack, if they're too tight or too weak or both, then all of the strain is going to the soft tissue that's supporting the spine, and eventually that's going to fail. So being in shape, I think, is important. But taking tension off your back, which stretches your muscles out, stretching, literally doing stretching every day, I think all of those things are helpful. Traction on your neck, there's all kinds of ways to do traction. There's like the inflatable little bladders you can put under your neck that some people use. It actually works. But I think the most important thing is making sure that you have muscular balance. Yoga, Pilates are good exercises, weight training with good form, and just stretching, just staying fit and avoiding impact. I think all those things are helpful. The crazy devices out there, I don't really know a lot of them other than the ones I talked to you about, but I think if you're careful and your form is good, and you're not doing aggressive torsion or torquing your spine, I think you're more likely to be safe long term. Impact is an issue, and rotation is an issue for the spine. If you do that too much and too often, I think it eventually leads to degeneration or disc herniations.
As a spine surgeon, do you have any strong takes on chiropractics?
Yeah, I like chiropractic for a lot of things, but there are some things that I'm not an advocate of. It feels good to have your back popped or your neck popped, but there are cases where if you do that in the face of an arthritic disc, that you can cause disc herniations. You can cause, disc herniations at the level of the spinal cord can cause paralysis. If you have a little clot in a blood vessel in your neck, or even if you don't, but you have tissue that's more likely to tear and you have your neck manipulated, you can stroke. Those are the things that I always caution people about, and my chiropractic brethren don't like it. I'm not coming down on them, but I think you have to be honest about some of the things if you do a high level, high speed torque to a disc that's arthritic and dry, it's like jerky versus steak, right? So it's more easy to tear if you rotate aggressively, whether you do it with a golf swing or a manipulation in someone's office, or if you are doing things that are aggressive in your weightlifting technique, right? If you're using terrible form, all of those things increase the risk of tearing your discs. And sometimes those tears are small and internal. Sometimes they're catastrophic tears that create a whole opening for the herniation of the nucleus to come through. So the problem is when you're doing those things, sometimes it's a slow process. You tear it internally, and now the process starts, and you start the slow process of degeneration of the disc that eventually leads to your spine becoming unstable and nerves becoming compressed and all the things that we treat surgically. So if you want to stay away from surgery, which you should, then you should be really careful about what you put your body through, whether it's aggressively swinging a golf club. And look, people do, right? People do that stuff. They love it. And I'm not going to tell them not to, but you just have to know what you're getting into. Like if you want to go to a chiropractor, just know that, repetitive manipulation can tear a disc if it's dry, right? Most chiropractors know when to stop because the ones that I know are like, okay, well, there's too much resistance here. I'm not going to push it. You need to go get an MRI. So I know a lot of them that are very careful. So I think if you go to someone who's very conscientious and who's really careful, then you're probably okay. They do a lot of stuff that I do like decompression. It's expensive, but decompression is like traction. It's just an expensive traction device. But pulling your spine and giving you like straight inline traction, I think is pretty safe. And then a lot of the stuff they do, like modalities, e-stim, ultrasound, cryo, I like all that stuff. So there's stuff they do I really like. I'm not a fan of high speed manipulation for the reasons I said.
Yeah, it's good that you made that distinction too of if they're feeling like a lot of resistance, that should kind of be an indicator for them to slow down and that maybe the patient isn't a good candidate for that and that they should go get further testing done. Is there any way to even know that you have like a blood clot or something that might get loosened before you go in for one of those?
There's really no way. I mean, if you have a history of it, if you have, if you're having symptoms like you're getting lightheaded, you know, little like if you've had a TIA in the past where you have like a little transient like imbalance or anything weird neurologically, but most people don't know. That's the problem. And a
Hmm.
lot of people don't even know they have crowding of the nerves in the neck. I see people all the time who have almost no symptoms, or they're like, my balance is off or my back hurts. And then I'll do an exam and I'm like, wait a second, your nerves look like this is coming from up high in your neck. So then we'll do an image of their neck, and they didn't even complain of neck pain, and they have severe crowding of their spinal cord from arthritic changes. And had they had someone to manipulate their neck, it could have been a problem. They could have ended up paralyzed. Now, just as a disclaimer, those things are very uncommon. We're talking small, small numbers, but you don't want to be that one uncommon example, right? Nobody wants to be that one person. So you just have to think about it. But like I said, most chiropractors that I've gotten patients referred from, they're like, hey, I'm not going to manipulate your back or your neck. I can tell there's something going on. You need to go see a surgeon. And that applies with physical therapists too. There are physical therapists that are too aggressive, and there are some that are like, I better not push my limits here. I'm going to send you to somebody. So it just depends on the practitioner. It can happen with any field. Even pain management, there are a lot of people that are like anti-surgery. So no matter what, I'm not going to do surgery, or no matter what, I'm not going to send you to a surgeon because they all do terrible. But that's not true. There's a lot of surgeons out there that have amazing results, and every surgeon who does surgery should be doing that because there's no other option left. And that patient's already been through everything. They've had therapy, they've modified their activity, they've stayed in shape, they've taken medications, they've had injections. All the things that you can do short of surgery have already been exhausted. That's when you go to a surgeon, right? And that's how I want it too. In my practice, we have all the conservative options because we want to exhaust those things before we talk about surgery. But when your spine is unstable and it's shifting all over the place, and you have spinal cord or spinal nerve compression, and especially if you have a neurologic deficit where you're weak in a specific muscle group, then there's no therapy, injection, chiropractor, medicine on the planet that's going to fix the structural instability in a spine. That's when surgery is necessary. And so if you're a kind of provider who says I'm not going to send anyone to a surgeon, then you're doing your patient a disservice. And if you're the kind of surgeon who does surgery on everyone, you're doing your patient a disservice, right? So again, that's why provider selection and physician selection is so important. You have to be really careful who you go to see. But yeah, conservative is key. But there is a time when conservative is not the answer anymore. And even though surgery is always the last option, sometimes it's the option left.
Is there any advancement going on right now in your field or in your business specifically that's got you really excited?
I like the idea of all of these hyaluronic acid injections in the disc. There's new growth factors and peptides. Everybody's on peptides now, right? Everything GLP-1s are peptides, sermorelin, tesamorelin, retatrutide, GHK. Everybody's talking about all these peptides. But there are peptides also being used for the spine to enhance bony fusion, which is really good, potentially enhance the discs. So I'm hopeful that I like the idea of one day being able to use a needle, injecting something and correcting the age, the trauma, the process of wear and tear. That would be really nice if we can do that one day, and potentially even eliminate my job as a spine surgeon, but that's okay. I'll find something else to do.
Just BBLs.
Maybe, I don't know. With GLP-1s, those are definitely on the downtrend. So, we'll see.
Amazing. Well, this has been unbelievably informative. If people want to learn more about what you're doing or get in touch with you, where should they go?
I think the best place to find us is at CyrMD, that's CYRMD.com. You can also find us on SA Spine, SASpine.com. Those are the two best
Amazing.
places. Yeah.
Well, Dr. Steer, thank you so much for talking to me today.
It's my pleasure. Thank you.
Of course. And thank you, everybody, for listening. Bye.
Bye bye.
If you know somebody that would enjoy this episode, feel free to share it with them. And thank you for listening to Galina Ravina Podcastina, the show where I try to be the person my dog thinks I am. Don't forget to hit that subscribe button so you never miss an episode. See you on the next one.